Dr. Joel G. Warsh, an integrative pediatrician, discusses several controversial topics related to children's health on this podcast. He emphasizes the importance of addressing the rising rates of chronic illness in children, which he estimates will affect 50% of children in the near future. Dr. Warsh advocates for a more holistic approach to children's health, focusing on nutrition, reducing toxin exposure, and lifestyle factors. He expresses frustration with the medical system's reluctance to discuss prevention and root causes of illness, instead relying heavily on medication. The conversation covers topics such as the impact of processed foods, environmental toxins, vaccines, and parenting practices on children's health. Dr. Warsh highlights the alarming increase in chronic illnesses among children, including conditions like eczema, allergies, asthma, and autoimmune disorders. He attributes much of this to poor nutrition, specifically the prevalence of ultra-processed foods in children's diets. These foods often contain excessive sugar, artificial additives, and lack essential nutrients. Dr. Warsh shares an anecdote about a patient whose health dramatically improved simply by changing their diet and lifestyle, emphasizing the power of these fundamental changes. He also discusses a study on autism that showed significant improvements in symptoms through dietary and lifestyle interventions. The conversation delves into the role of environmental toxins in children's health. Dr. Warsh explains that children are exposed to a toxic soup of chemicals in their daily lives, from food additives to household products. He cites a study comparing BPA levels in people who consumed canned soup versus homemade soup, demonstrating how even small changes can significantly reduce toxin exposure. Dr. Warsh advocates for a precautionary approach, suggesting that families should assume many common chemicals are potentially harmful and take steps to minimize exposure where possible. Dr. Warsh addresses the highly contentious topic of vaccines. He expresses frustration with the polarized nature of the vaccine debate, arguing that it should be possible to have open, rational discussions about vaccine safety and efficacy without being labeled as anti-vax. He emphasizes that he is not against vaccines, but believes more independent research is needed, especially regarding the current vaccine schedule and potential long-term effects. He advocates for a more personalized approach to vaccination, taking into account individual children's health status and family history. Dr. Warsh introduces his SEEDS approach to health, which stands for stress, exercise, environment, diet, and sleep. He emphasizes the importance of managing stress, both for parents and children, as chronic stress can have significant negative impacts on health. Exercise is crucial for children's development and overall health, with Dr. Warsh advocating for building movement into daily life rather than relying solely on structured exercise. The environment refers to minimizing toxin exposure and creating a healthy living space. Diet, as previously discussed, is fundamental to health, with a focus on whole, unprocessed foods. Finally, sleep is essential for children's growth, development, and overall well-being. The podcast touches on several controversial topics in parenting and pediatrics. Dr. Warsh discusses the debate between breastfeeding and formula feeding, advocating for breastfeeding when possible due to its numerous health benefits, but acknowledging that formula is a necessary and valuable alternative for some families. He addresses the use of Botox during pregnancy and breastfeeding, recommending against it due to lack of research on its safety for developing fetuses and infants. The topic of co-sleeping is also discussed, with Dr. Warsh emphasizing the importance of informed decision-making rather than blanket recommendations against the practice. Throughout the podcast, Dr. Warsh emphasizes the need for open, non-judgmental dialogue between healthcare providers and parents. He expresses concern about the current state of medicine, where certain topics are considered off-limits for discussion, leading to distrust and division. He advocates for a more personalized approach to pediatric care, taking into account each family's unique circumstances, beliefs, and preferences. He stresses that the goal should always be the health and well-being of the child, and that this is best achieved through collaboration and mutual respect between healthcare providers and parents. Dr. Warsh offers several practical pieces of advice for parents looking to improve their children's health. He recommends reading food labels carefully and avoiding products with long lists of unfamiliar ingredients. Reducing sugar intake, especially added sugars, is crucial. He suggests buying organic produce when possible to minimize pesticide exposure. Dr. Warsh also recommends using a good quality water filter and air purifier to reduce toxin exposure in the home. He emphasizes the importance of varying children's diets to prevent overexposure to any particular toxin that might be present in a frequently consumed food. The podcast concludes with Dr. Warsh encouraging parents and healthcare providers to work together for the benefit of children's health. He emphasizes the importance of open communication, informed decision-making, and a willingness to consider alternative approaches when conventional methods fall short. Dr. Warsh promotes his book, Parenting at Your Child's Pace, an integrative pediatrician's guide to the first 3 years, as a resource for parents seeking a more holistic approach to their children's health. He also mentions his online parenting community as a platform for continued discussion and support.